Well, as I like to say, if I put 10 myeloma doctors in a room, I have 15 opinions. So it is very difficult to obtain consensus in multiple myeloma and relapsed myeloma in particular. So there really is often controversy, but not a sort of controversy that really invokes serious battle, but more based on the fact that now we have thankfully more choices than we've ever had before. So I have the privilege here at SOHO of moderating a session where we are discussing some of these areas of consensus and controversy. So a few of note include the following. Number one, should we be introducing CAR T-cell therapy in the majority of patients at early relapse? We know now that we have FDA approval to use cilta-cel as early as first relapse, ide-cel as early as second relapse, and should we be doing this for the vast majority of patients? And of course, the answer always is it depends. It depends on the nature of the disease in that patient, obviously the patient themselves, and indeed their preference to make that decision. We're also partly guided by the challenges of toxicity, where we know these drugs can bring tremendous efficacy, but they come with challenge as well. So that is always a great area of conversation. The second area of controversy that arises very often is how do we deliver in the best way possible the bispecific antibodies that we have in relapsed multiple myeloma? These drugs have really revolutionized how we treat patients, in particular those who may not be eligible for CAR T or have already had a CAR T-cell therapy, but we now have 4 different bispecific antibodies that have been approved. What are the differences between them? Should we be giving them weekly like they were initially given? Can we go out to every other week? Can we go to once a month? These are the kinds of things that we wrestle over, always trying to find the greatest efficacy, but also the greatest safety as well. And I think they speak to us of a clear trend in myeloma where we absolutely over time change the way we use our agents to increase their efficacy and reduce their toxicity. So those are some of the areas of controversy and of consensus that we have in myeloma today. But of course, tomorrow that'll change as well because it's such a rapidly evolving field.